Today, we are pulling the curtain back on something that many fear, but few understand it. This is anesthesia. People worry about not waking up or not feeling everything. But how much of that is true? So we are going to explore the facts, face the fears, and also reveal the safety behind the sleep of anesthesia. I'm Dr. Joshua Dirito, a family physician. I have an interest in public health, cancer prevention, and treatment. In this video, we are going to look at what is the anesthesia. We are going to look at some of the facts about anesthesia, and we are also going to look at the myths about anesthesia, so that we know what is real, why the fear, and what is the risk involved. I felt very scared, and I thought I would not wake up. So before the surgery, Mary whispered, "Please do not let me die due to the anesthesia." Her fear is common, but what is the real risk of dying during anesthesia? Maria's words echo the fears that many have, and it is what in many people's heart. When I am put to sleep, will I wake up again? Will I live after this? But this fear, is it backed by myths or is it driven by facts? Today, we are going to look at how anesthesia has evolved and how it is safer than ever as new ways of anesthesia have been discovered, and more safer ways of getting people to sleep. So what is anesthesia? It is important that we understand it. It is more than sleep. It is more controlled science that helps someone to get into sleep and be able to have no pain as he undergoes his or her operation. So what does anesthesia do? It blocks the pain. It can make you unconscious. It allows surgeons to operate without distress. Before the advent of anesthesia, it's one of the major breakthroughs in medicine. People would undergo anesthesia being held by others, and you can imagine the struggles, the pain that people would go through, and it was even dangerous. Pain itself can kill you, and so when you are under anesthesia, the surgeons can be able to operate without you feeling it, without you struggling, and it is even safer. And the healing process is also good. When you have pain, you are struggling, and more injury to tissues can happen, and this endangers your life. So remember that every moment that you are under anesthesia, you are being monitored by qualified personnel whom we call anesthesiologists. People might not know them very much, but they are the people that make surgery possible. They may come and see you before your surgery and possibly talk to you in a few minutes, and then they will be the people who will talk to when you are being put to sleep as the surgeon is preparing. So anesthesia is not just sleep. It is carefully a mix of medications that keeps your body pain-free, calm, and also safe during the procedure. When we mean your body becoming calm, remember that our body are going through many processes, and one of them is the muscles can be stiff, but anesthesia makes your muscles relax. Apart from removing pain, they also help to relax your muscles so that your muscles are not struggling with the surgery. So, what are some of the myths about anesthesia? And if you have heard about this, keep listening. You won't be able to wake up. It is extremely rare with modern anesthesia for you not to wake up. You will feel everything. Monitoring ensures that you are in deep sedation and your awareness comes back after the surgery, and you are sedated in a controlled way. And when your surgery is coming to an end, the anesthesiology or the doctors who have put you to sleep starts reducing the drugs so that you can get back to your normal self. So, and some people feel that anesthesia damages your brain. There is no proven risk between anesthesia and the damage to your brain, and the drugs used to put you into sleep are very safe. So do not fear anesthesia. Some people think that when you are put under sleep, then you stop breathing. Your breathing is supported and watched closely. Your oxygen saturation is well monitored, and someone is there to make you safe throughout the surgery. So these are some of the biggest myths that we have about anesthesia. But what you should know is anesthesia is safer than ever before, and there are very well trained teams that are in charge of you with real-time monitors, and they will react very fast if anything abnormal is noted. Then, what are the real risks in anesthesia? Be informed but not afraid. In rare instances, you may have allergic reactions. Just like all drugs that we have can make you respond in of a response when you are using them. You can also have nausea and vomiting, and that's why before any surgery you are told not to eat anything so that we avoid the nausea and the vomiting. Of course, there are drugs that can be used to help you to stop the nausea and the vomiting and make your life safe. Then breathing issues can be a high risk to patients, but there is monitoring that is going through all through your anesthetic when you are asleep and through the whole operation. So you need not fear. Awareness and anesthesia. This is extremely rare. Of course, these days we are doing what we call regional blockage, whereby not the whole of you is put under sedation. And especially if you're having operations that are affecting the lower regions of the body, from your belly button and below, things like cesarean sections, things like operations on the lower limbs, they can comfortably be done by blockage of your spinal cord. And yes, you can feel what is happening, but you are not feeling pain, and your organs are well relaxed for the operation to go on. And the beauty of this is most of the time that you are put under sleep, then the risk of vomiting and feeling nausea and risking the airways are more. But even when you are under regional anesthesia, sometimes it can fail and you may need to be put under general anesthesia. And that is why you are not told not to eat anything. Remember that no procedure is risk-free, but with good communication and screening, most risks are manageable. Knowing your medical history also helps the anesthetist to choose the safest path for you. So, what are some of the things that you need to know before your anesthesia? If you want to prepare like a pro, what can you do? One, share full medical and allergy history so that your anesthesiologist knows what are the risks that you have. Mention any previous risk to the anesthesia team. Follow the fasting rules, as I said. I've talked about preparing for surgery in one of my previous videos. You can check it on the Overall Health YouTube channel. Then stay calm and ask questions. Again, I've talked about what you need to know before your surgery. So if you have any doubt, prepare yourself. Preparation is protection. Talk to your anesthetist. Be honest. If anything as small as chewing gum before the surgery could be risky, so do not endanger your life. So what is the role of the anesthetist or the health personnel who are monitoring you during the surgery? They are your guardian during the surgery. So they monitor the patient during the surgery. They monitor the oxygen levels. They monitor your heart rate. They monitor your blood pressure. They monitor the depth of your sedation. They monitor your reaction to the surgery. And every second, they are monitoring what is happening to you. And they can be able to tell when things are going wrong and inform the surgeon, and emergency remedial steps are taken. You may never see their face again apart from when they are putting you to sleep, but your anesthetist is your silent protector. They warn the surgeons when it is not safe to do the operation. They also tell the surgeons when some remedial steps need to be taken. They ensure your body stays stable through it all, and they make sure that you wake up successfully and get back. This is not the feeling. He is the unsung hero of modern surgery. They are the ones who make sure that everything is okay. They make sure that you are well protected. So trust the science and trust the team. So behind every successful surgery, there is a vigilant anesthetic team. So let go of fear. And if you have any fear, because fear is common to human beings, knowledge is your strongest ally. And talk to your anesthetist. Ask him any questions that you have that you might need answers. So do not be afraid. I will say this again, do not be afraid. And this is a phrase that is also repeated many times in the good book, the Bible. Do not be afraid. But remember that anesthesia is safe and properly managed. Myths fuel fear, and facts could help you build trust. And communication with your medical team is critical. Follow pre-surgery preparations and instructions carefully. You are being cared for every second, and your surgery should go well. So don't fear. Don't let fear get you not get the surgery that you need. Anesthesia is not something that you need to dread. It is something to prepare you and make sure that you are in good hands and your surgery goes well. So, if you need to undergo any surgery, remember that you will be monitored by the surgeon who will do the operation. But there is a team that is monitoring you every second to make sure that everything goes well. Tell them about your fears. Tell them about medical conditions that you have. Tell them about your previous experiences with the anesthesia so that they can be able to help you better. Take charge of your health. Talk to your anesthetic team. If you like the content of this video, share it within your circles. Remember also to subscribe to the overall health YouTube channel for more insights. Thank you. We meet in the next video.